Let's head to the Middle East, where an Israeli airstrike near a hospital in southern Beirut is now said to have killed 18 people, including 4 children. The overnight strike appeared to hit buildings in a densely populated area opposite the Rafik Hariri University Hospital, the country's biggest government-run hospital. Lebanon's health ministry says more than 60 people were injured, most of them children. Israel says it was targeting Hezbollah facilities. And these are pictures of a large bomb hitting a building in southern Beirut, causing it to collapse. An evacuation order was issued an hour before, and there's no confirmation of any casualties. I was concerned about the humanitarian crisis in northern Gaza grows. The US Secretary of State Antony Blinken is in Jerusalem, where he's been meeting Prime Minister Benjamin Netanyahu in a bid to reinstate the diplomatic process for a ceasefire between Israel and Hamas. Blinken has released 5 priorities to try to end the conflict in the region, and they include reviewing humanitarian assistance to Gaza and aiming to de-escalate the war in Lebanon. Well, our correspondent, Emir Nada, is currently in Beirut, while Wira Davis is in Jerusalem. Earlier, Emir outlined the latest on Israel's attacks on Lebanon.
Since last night, there's been a heavy series of Israeli strikes, both in Beirut and continuing around the rest of the country, the rest of Lebanon, throughout the day. One of the most significant airstrikes, as we've been reporting throughout the day, was that strike in the vicinity of the Rafik Hariri Hospital, which the latest tally, around 18 people were killed, 4 of whom were children, and around 60 people were heavily injured. The search and rescue operation has been continuing through the day, and we've watched that number slowly rise. The Israeli army has said they weren't targeting the hospital itself, but a Hezbollah target near the hospital, but they didn't elaborate on the nature of what that target might have been. The hospital itself was damaged, though no one inside the hospital was hurt. And throughout the day, we've seen a continuation of Israeli strikes, significantly in the south of the country, in the Bekaa Valley, in the east of the country, and in the north. One round of Israeli strikes in the city of Nabatea, in the south of the country, killed around 13 people, which local media said were all from the same family, and first responders there were exposed to 2 subsequent airstrikes which injured those first responders. We've also seen around 5 people who've been killed in the north of the country, in the village of Hermel. So we've really got the sense that there isn't no pause in these airstrikes happening here in Lebanon, not just here in the capital, Beirut, but in the rest of the country as well.
Amir, thank you for that. Let's go to Wira now in Jerusalem. Wira, let's talk about Antony Blinken, US Secretary of State, US's top diplomat there yet again. What is he hoping, trying to achieve?
Well, this is Blinken's 11th visit to the country and the wider region since the start of the war on October the 7th last year, but perhaps expectations even before his 2.5-hour meeting with Benjamin Netanyahu were very low, and no real hopes of a breakthrough, certainly regarding a ceasefire. That's mainly because even though international diplomats had seen a bit of a window of opportunity after the killing of Yahya Sinwar, the leader of Hamas, last week, the Israeli Prime Minister's view of events is that Israel has got to finish the war in Gaza first before he can declare an end to the war and start talking about a ceasefire. And to that end, we got 2 very different what we call readouts from either side after this meeting. From the American side, Mr. Blinken, spokesman, said he thought that Israel needed to capitalize on the successful action to bring Sinwar to justice and secure the hostage release and end the conflict.
Thanks to Wira for that, and for Emir as well just before that. I want to speak now to Dr. Thair Ahmad, who's inside. He's a US emergency physician, a volunteer at Med Global Lebanon, an international NGO providing healthcare support to people living in crisis zones. Thank you for coming on the programme.
Thank you for having me.
What are the conditions like there that you're working under right now?
Well, I mean, it's incredibly tense. I think everybody in Lebanon is very concerned about the recent developments. The hospital, Hariri Hospital, getting hit so close and sustaining some damage, as well as many casualties there. is reminding people of what took place in Gaza and how there were no red lines when it came to healthcare infrastructure. It's important to remember that over 75 healthcare workers here in Lebanon have been killed, and much of the south has been leveled. So here in Saida, where I'm at now, there are hundreds of thousands of displaced people. There's more than 1 million displaced people across Lebanon. Many of them are out in the streets or sleeping in their cars. And there's only a fraction of the aid that they need. There's only about a fifth of the aid that Lebanon needs. And today, the crisis minister said that Lebanon needs $250 million a month to support these 1.3 million displaced people. And I tell you, everybody here, there's a consensus. They believe that this is going to drag on and that a lot of Lebanon is going to be affected by this, not just parts of Beirut or southern Lebanon, but almost all of Lebanon. And that's very concerning.
I just want to focus just for a short period on emergency workers themselves, people who are out and about and putting themselves at risk. What measures can be put in place? Is it at all possible to try and make sure that health workers can try and operate safely?
Absolutely. I mean, that is an excellent question, because what there needs to be is some sort of deconfliction system. This is something that has existed in the past. It's essentially where the Israeli military is aware of hospitals and healthcare workers, first responders, people who are trying to save lives, and that they do what they can to avoid those types of casualties, to avoid attacking them or to avoid any sort of accident that takes place. Unfortunately, the early signs here in Lebanon resemble what's gone on in Gaza, in that there are no red lines when it comes to healthcare workers or healthcare infrastructure. We're seeing that they are in the line of fire. And oftentimes it really does appear, based on the scenarios, that it's very indiscriminate, and even healthcare workers are targeted. One thing that you see as a result of this, the reason that we need to make sure that there is a deconfliction process, is that healthcare workers and hospitals, when they shut down, you see an astronomical rise in the amount of people who die, people who could have been saved, that sort of idea of excess mortality. People are dying unnecessarily. It's something we saw in Gaza, and it looks like it's being repeated here in Lebanon. And so I think that's very important for us to be able to at least have those protections in place and to abide by international humanitarian law. It's that simple.
And just briefly, on the issue of supplies and medical supplies specifically getting in, presumably there is not the same issues as getting aid into Gaza there in Lebanon. What is the situation?
Yeah, you know, it's different. It's easier to bring supplies in. There's also some ability for local procurement. But one concern that we're seeing is, first, that when these strikes continue to expand and they are so close to the international airport, that you start to have a delay in the medical consumables, in the medications, in the humanitarian aid arriving and being delivered. And the other thing that we're seeing too is that if we're not able to bring in these supplies in a timely manner, then you start to see tension rise among people who are desperately in need of these sorts of supplies. And so that's something that's very concerning as the Israeli military continues to expand its airstrikes across Lebanon. There has to be a route for humanitarian aid to get in, and it needs to be able to distribute it to the people who need it.
Ahmad, thank you very much for coming on the programme. Thank you.
Thank you.